Today, we're going to talk about alpha-gal syndrome. Before we do that, what exactly is alpha-gal? Well, alpha-gal, also known as galactose alpha-1, 3-galactose, is a sugar molecule found in most mammals. Interestingly, it's not present in fish, reptiles, birds, or even humans. But you'll find it in meat like pork, beef, rabbit, lamb, venison, and other products derived from mammals, such as gelatin and cow's milk. Alpha-gal syndrome, or AGS for short, is a serious and potentially life-threatening allergic condition. It's also referred to as alpha-gal allergy, red meat allergy, or tick-bite meat allergy. One crucial point to note is that AGS is not caused by an infection. Instead, symptoms occur after people consume red meat or come into contact with other products containing alpha-gal. So, what are the symptoms of AGS? AGS reactions can vary and may include hives or an itchy rash, nausea, vomiting, heartburn, indigestion, diarrhea, coughing, shortness of breath, difficulty breathing, a drop in blood pressure, swelling of the lips, throat, tongue, or eyelids, dizziness, faintness, and severe stomach pain. These symptoms typically appear 2 to 6 hours after eating meat or dairy products, or after exposure to products containing alpha-gal, like medications with gelatin coatings. It's essential to understand that AGS reactions can differ from person to person, ranging from mild to severe, even life-threatening. In some cases, anaphylaxis may occur, which is a potentially life-threatening reaction involving multiple organ systems, requiring urgent medical care. Also, not everyone will have an allergic reaction after every exposure to alpha-gal. If you suspect you might have AGS, please reach out to your healthcare provider. AGS can be severe, and in case of a severe allergic reaction, seek immediate emergency care. Now, one question that often arises is, can you get AGS from a tick bite? The answer is yes. AGS is primarily associated with the bite of a lone star tick in the United States, although other tick species have not been ruled out. In different countries, other ticks have been linked to the development of AGS. However, more research is required to fully understand the role ticks play in triggering this condition and why certain individuals develop AGS. If you suspect you have AGS, how is it diagnosed? AGS is typically diagnosed by an allergist or other healthcare provider through a detailed patient history, a physical examination, and a blood test that looks for specific antibodies related to alpha-gal in your immune system. Allergy skin testing may also be recommended. In case you are diagnosed with AGS, it's crucial to manage the condition under the care of a healthcare provider. Since many foods and products contain alpha-gal, you will need to work with your provider to understand which ones you should avoid. Additionally, preventing tick bites is essential, as new tick bites may reactivate allergic reactions to alpha-gal. Speaking of foods and products to avoid, it's essential to note that not all patients with AGS will have reactions to every alpha-gal containing ingredient. However, most healthcare providers recommend patients with AGS to stop eating mammalian meat like beef, pork, lamb, venison, rabbit, etc. Depending on the severity of your allergic reaction, your healthcare provider may also suggest avoiding other foods and ingredients that may contain alpha-gal, such as cow's milk, milk products, and gelatin. Always remember to read food product labels carefully, as alpha-gal can be present in unexpected places. Another crucial point is that while very rare, some individuals with severe AGS may react to ingredients in certain vaccines or medications. Therefore, it's essential to consult with your healthcare provider before taking new medications or receiving a vaccine. Now, you might be wondering who is at risk of developing AGS. The answer is that anyone can get AGS. Most reported cases in the United States are among people living in the South, East, and Central regions. While AGS can affect people of all age groups, it's more commonly reported in adults. So, what can you do to prevent AGS? Well, preventing tick bites is crucial and can reduce your chances of developing the condition. Before you head outdoors, avoid grassy, brushy, and wooded areas where ticks may be found. Stick to the center of trails while walking. Treat your clothing and gear with permethrin or purchase pre-treated items. Use insect repellents that are registered with the Environmental Protection Agency, EPA. After coming indoors, check your clothing for ticks, examine your gear and pets for ticks, and take a thorough shower to remove any ticks. If you spot an attached tick, remove it immediately. And don't forget to take steps to prevent ticks on your pets and in your yard. That's all for today's video. We hope you found this information helpful. If you have any questions or want to share your experiences, please leave a comment below. Remember, if you suspect you have AGS or have any concerns about your health, talk to your healthcare provider.